Dr. Jennifer Villalta, and I am a pediatric dentist here in beautiful Los Angeles, California. I wanted to share a little bit about pediatric dentistry, kind of like my day-to-day routine, so that way hopefully I can interest some of you to become a pediatric dentist, because honestly, it's the best specialty out there. Let's be real. Who else gets to wear costumes all the time? So hopefully you guys will enjoy this. I'll finish up the day by answering a whole bunch of questions, so hopefully I can help you guys on your road to becoming a dentist and hopefully then a pediatric dentist. Happy Friday! I like to get to the office early because I like to review my day and kind of have everything planned out for my patients, my team, so that way we're all on the same page. We can be efficient. That's very important in pediatric dentistry, to be efficient, to make sure that you see your patients on time, make sure that you provide the best treatment, make sure that you make it a great experience for these children, because what we're trying to avoid is later on having phobic adult patients who act a lot worse than kids, to be very honest with you, which is one of the reasons why I love pediatrics, because you can really restructure their minds and help them have a positive outlook on the dentist, as opposed to, most adults who the first thing that they say when they meet you is, I hate the dentist. I don't like that. I want my kids to be excited to come see me and to come to the dentist. So this is kind of like my routine in the morning time. Finished my first treatment of the day. It was actually, this is one of my favorite patients. She came in, she's 17 years old. She's super phobic. The first time I met her, she was crying, shaking. She couldn't even open her mouth to let me look. And we've gotten to the point where now I can do a lot of treatment on her. She feels comfortable. Nitrous definitely helps a lot. But we've just created such a great relationship that I feel like her trust in me makes a world of a difference, because she had a lot of treatment that needed to be done. So I'm just going to kind of go over her case. She has all adult teeth. So the really cool part about being a pediatric dentist is that you're not limited to only baby teeth. I can do big teeth too, you guys. So you can do a whole scope of things. So check this out. This is one of the teeth that she presented with. Yowzas. And this is all calculus buildup, plaque buildup. This is all gingival tissue that's grown into this cavity that she had. This is a bite wing radiograph. And right here, all of this that you see that's gray, that's all infection. It's all tooth loss. It's all a cavity. So this was into the pulp. And I referred her to an endodontist, a root canal specialist, so that they could do a root canal for her. These teeth right here also have recurrent decay. You can see that right there. You can see new decay here. Here, this was pretty big actually, right here. So we were able to do stainless steel crowns on these, and then we did a stainless steel crown on this little guy, and then she had a filling on this little guy that we did today as well. This is behind the scenes with my favorite people. Should I show you? No. Yeah. So after we use all of our instruments, we sterilize them in here. It's called an ultrasonic cleaner. We leave it in there so it can jiggle out all the crummy stuff, all the blood, and then it comes over here. Desiree is amazing, always keeping everything clean. And then we put them in these little packs. And then this is the sterilizer where everything gets sterilized so that each new patient has nice clean instruments. And then this is after. They come out and they let them dry for a little bit. And then we put them away all nice and neat because we're OCD around here. Okay, so this is behind the scenes. Yes, it is.
just to make sure I don't miss anything, because days can get hectic. You know, we have emergencies, we have sometimes we'll be seeing 3 patients at the same time, so have to make sure that dot my I's, cross my T's. I'm finally done with work. It's 7:07. Ooh, lucky number 7. I like to stay after work just to finish all my notes to make sure I didn't miss anything. I look at all of my x-rays, all the treatment plans that were inputted. Kind of wanted to show you guys what a typical schedule looks like. This was our schedule today, which was pretty light, but we only had 1 assistant. So I'll show you guys. Yesterday, this is kind of like a lighter day, actually. Most of my friends probably see double the amount of patients, but usually in this column, I'll have treatments that I'm doing, usually in the section of either new patients, emergencies, recall appointments, and the third column is the same thing. So usually for a day like this, I would like to have 3 assistants, because while I'm seeing patients here, I'm saying usually the first column is for treatments that I have to do. So restorative treatments that usually involve local anesthesia, the use of nitrous, things like that. The second column is the column after that patient, I can see this patient, go back to this patient if I need to, and then by that time the next patient's there. So you're literally just going back and forth, back and forth. I'm anesthetizing, I'm doing restorative treatment. They can take another patient, they can take their x-rays, they can do their cleaning, talk about oral hygiene with the parents, and then hopefully by the time that I can sneak away from this procedure, I can go see this patient.